All right. Karen, let's also take that, if you will. I think one of the problems that we have and have continued to have over my 15 years in it has been this volume price model that we keep throwing into this thing. We've had a purchasing model that says, okay, we'll give you more volume, okay, give us lower price, and that never materializes. I think one of the things we have to do if we're going to exist under our current environment is we got to get away from a price volume. There is no volume to promise out there if we're going to continue with access in healthcare, and we got to find some other means. To Jim's point, I think that could be done more in a collaborative approach, if you will, getting some of the influencing organizations together, and from those organizations, then working toward how can we get the measurement, the quality measurement that we can then go to Congress to change the...
I got to take a break. When we come back, we're going to get into the business of, is there a quid pro quo here? Is physician accountability something that hospitals have the right to ask for? Also, when we come back, we'll take some questions from the audience later in the program. A remarkable turnaround of a healthcare system. We'll tell you all about it as NCI Talk continues.
Looking for new hospital beds? The new benchmark has been set. For world-class falls prevention, for unsurpassed clinical effectiveness, for superior infection control, for pit stop maintenance, Enterprise, designed for life. The Enterprise 9000 Advanced Hospital Bed. Enterprise. New from Huntley Healthcare. Join NCI May 7th through 9th in Orlando, Florida, and take on a major role of collaborating to rewrite healthcare's supply chain playbook. First, participate in on-field collaboration competitions led by two collegiate football greats, Bo Schembechler and John Robinson, guiding participants through exercises that help them rewrite the college football playbooks. Then, participate in a series of off-field exercises led by supply chain logistic experts, bringing inside and outside industry experts, guiding participants toward rewriting healthcare supply chain playbooks necessary to produce innovative outcomes. Medical surgical manufacturers, distributors, and hospital materials management attendees will team up together to design the playbook to achieve end-to-end medical surgical supply chain integration. The teams will be directed to focus on the end solution while considering the necessary elements integral to designing and executing strategies and tactics for the ideal playbook, such as spend management, optimal utilization management, effective and efficient inventory management models, fostering clinician relationships, and superior patient satisfaction. Pharmaceutical manufacturers, distributors, and hospital director of pharmacies will team up together to design the playbook on end-to-end barcoding and solution while considering the necessary elements integral to designing and executing strategies and tactics for the ideal playbook. At the conclusion of the collaborative work sessions, chosen team members representing medical, surgical, and pharmaceutical teams will present their proposed end-to-end solutions to one another to explore the opportunities for end-to-end supply chain integration. Following the meeting, NCI will produce a white paper documenting the outcomes from the collaborative exercises and distribute to all participants. NCI will also produce a DVD of the on-field competitions, capturing special moments shared with Bo and John to distribute to all participants. We hope you choose to be part of healthcare's innovative playbook. Get in the game.
Welcome back to NCI Talk, everyone. We were talking about the medical crisis as it exists today in the industry and how some hospitals are struggling while other companies are flourishing. Let me just move on to this subject of physician accountability. Hospitals without physicians is like an airline without pilots. Got to have them. It's the business. But yet at the same time, Karen, Barrow, why don't I start with you? Is the physician in today's hospital as accountable as he or she should be?
The I truly believe, I'm a big advocate of the physicians, you're going to see this, that given the credible data, physicians will work with hospitals. And if you may have to align your incentives, you may have to come to the physicians and say, here's our cost, here's our reimbursement, and you know what, for a hospital, occasionally you have to say, what can we share back with you? The majority of the time, these physicians have taken huge cuts in their reimbursement too. I can guarantee you, you've taken a 30% decrease in your reimbursement for our total joints in the past 15 years.
30%?
So, 30%, more than that?
Let's see. I am paid about less than half of what I got paid, so it's more than 30%. So I'm paid now about 40% of what I got paid when I went into practice for the same procedure that I do, which I'm about probably much better at because I've been doing it for 15 years. Mm-hmm. When I went into practice, I'm going to give you some hard numbers. They were reimbursing me about $3,500 to the total hip.
That's right.
Today, for the same procedure, they reimbursed me about $1,200 for the same procedure, $1,250, I believe. From $3,500 to $1,250. Now, I don't think my hands have gotten any worse.
No, and your overhead hasn't gone down. Your overhead's gone up, right? With the liability insurance, everything.
Right.
And
cost of the doing practice.
When the physicians come to the table and we ask them to cooperate with us, to negotiate with our partners, the suppliers, they come in going, wait a minute, all I have done for the past 15 years is give up, give up, give up. I spend more time in the ER, I spend more time in my office, I see less of my family, and one more time, somebody wants me to give something back. So I think we're to a point where, in addition to looking at the cost and the quality, we need to be prepared to give something back to the physicians. And I'm continually amazed that the majority of the physicians we work with, it's not that they want cash, they're looking for efficiencies. Help me turn that OR suite over. Right. You know, help me out here. Give me a PA that'll make sure my H&P is done. Give me a PA to make sure that the discharge planning is done. Everybody wins. We're not excluding the patient when we do things like that. The patient wins there too. So we're cost-effective quality care, and the physician is much happier because that savings that we're getting from the hospital, we're giving a portion back to improve their life and their patient's care.
You hit the nail on the head. In fact, the hospital that I currently use, and what I do is I promise them I'll bring you 6 or 7 total joints in a day, guaranteed. I'll guarantee you 6 or 7 every time I go there.
I'll take it.
And what I tell them is, but you have to promise me 2 rooms. Because if I have 1 room, because there's so much instrumentation, you literally, it's 2-hour downtime. It takes me, I've been doing it long enough, it takes me an hour to replace a hip or a knee. But it takes me 2 hours to sit in the lounge room waiting for the next case to be ready. But when I went to the hospital, I said, you give me 2 rooms and make my turnover 15 minutes, and I'll bring you all my cases. That's exactly what they did for me. And so I'm able to now do 6 or 7 cases in a day, of major cases, whereas previously I was able to do maybe 3 and be home by 6, 7. Now I can do 6 or 7 and be home, eating dinner with my family by 6 o'clock.
And you're more concerned now about the hospital and more probably aware of the cost and helping the hospital out than you ever have been, correct? I mean, because they gave something back to you,
sure.
Are you more willing to work with them now?
Absolutely.
Okay, but Dr. Reimbursement, and as Dr. Choi just said, his reimbursement is going down and down and down and down and down. I began this program by talking about Ford Motor Company, which is at this particular point doing very poorly. General Motors is not doing very well. We live in a day and age where consumer dollars have gone in a different direction. Are they like anybody else? Are they a provider of a service who unfortunately has to take a cut like everybody else?